So we are still with the analytical study designs. In this video module, we are just dealing with other types of analytical study designs or the advanced analytical study designs, which can be asked from your MCQ perspective. And in the last of this video module, I'm going to summarize all the analytical study designs, and that will be the most high yield topic for your exams. So make sure you stick on to that. Talking about the advanced analytical study designs, beta, first study design, advanced type you need to do is what is ecological study. Ecological study design, I'll help you write down first, and then we are going to discuss a little bit in detail about the ecological study design. It is the unit of study. The unit of study of an ecological study design is the population. In the ecological study design, you will do what? You will find what? We find correlations between variables. You find correlation between variables or related factors. You find that whether this factor is correlated, yes or no. In the ecological study design, usually a third party data source is usually taken. I'm not saying always, it is usually taken. A third party data source is taken. So you do correlation between events or between the variables or the factors. The unit of study is a population. There is a special bias of the ecological study. The bias of the ecological study is called as ecological fallacy. The bias is called as ecological fallacy. See, beta, let us say that I want to find out the effect of maybe smoking on ischemic heart disease. Smoking on ischemic heart disease. Does smoking cause more ischemic heart disease? So let us say that I was wondering in my PG that how to do a study. One way to do the study is that I go to the area, in this whole area, I find out how many people are there. Out of this area, I find out how many people are actually having the coronary artery disease. Out of these coronary artery disease, I find out that how many are actually smokers. So let us say the smoking population was this much. So this many were smokers. So technically these were the population who were smokers and were having the ischemic heart disease. What type of study design is this? This is a very simple cross-section study design. Let us say I take 100 people who were with coronary artery disease and 100 people without no coronary artery disease, and I ask them, do you do smoking? Yes or no? What type of study design? This is a case control study design. Let us say I take 100 individuals who are smokers and 100 people who are non-smokers. I follow them up for a period of 1 year or 2 years or 5 years or 10 years. And then I find out how many people get yes coronary artery disease or no coronary artery disease. What type of study is this? This is a pure type of cohort study design. I have another way to find out the smoking on the ischemic heart disease. Let us say that for every case of coronary artery disease, we are going to insert a stent or angiography or angioplasty was done, or some angioplasty, some stenting was done, right? Coronary artery stenting was done. So I know that in Delhi or in Mumbai or in Kolkata or in 5 states or in the whole country, how many stents were sold in one city. And in one city, I also know, because smoking or cigarettes is a regulated item. So we know that how many cigarette packets, how many amount of cigarette packets were sold in this particular state. So how many cigarette packets sold in the state and how many stents are sold. You can also find out how many alcohol bottles were consumed in that state during 1 month and how many heart attacks were reported in that state. You can also find out how many people are alcoholic and how many people have breast cancer in the country. You can also find out how many IUDs were being sold or being used in the country, and how many people were getting any infections due to IUD related infection. You can do whatever you want. Are you able to get it? This type of study, if I do it in Delhi, I can also compare it with Tokyo in Japan. I can compare it with California state in US. You can compare it with UK. You can compare it with anything. So technically you are comparing the population. This type of study design, where you mind the words, where you compare the populations. The unit of study is the population, not about the one patient, one disease. So the unit of study is population. You are trying to correlate the events, and usually we use a third party data resource, that how many cigarette packets were sold in the city and how many people got stents and things like these. And there is a special bias, we will talk about this bias, that is called as ecological fallacy. So these are your pure hardcore keyword points that you get in your exam. You find these questions, you find these options, and you mark these options. That's how it works. Now, what is ecological fallacy? Beta, this question can be asked, what do you mean by ecological fallacy? Ecological fallacy, it is a type of a bias. It is where the results of an ecological study is not applicable at individual level, or it is usually biologically not applicable. A very frequently given classical example is that in United States, they found out that when the breast cancer mammography was introduced, it led to more diagnosis of breast cancers. So on a population level, if you say that as the mammography is increasing, the cases of breast cancers or the deaths due to breast cancer is also increasing, does it make sense? Obviously, you are going to diagnose more. So because more diagnosis, more people might die. But the results of the ecological study are not biologically fitting. So you are actually trying to diagnose the disease early. This type of fallacies, this type of bias are called as ecological fallacy, where the results of the ecological studies or any study for that matter are not applicable at individual levels. That fallacy or that bias is called as ecological bias. That is your first study design. The next one is point number 2. Let us talk about what do you mean by the concurrent and the non-concurrent cohorts. Nothing very special, no brainers, very simple to understand, beta. Let us say I take 100 individuals for whom we are going to test for coronary artery disease, and let us say it's a follow-up study. Usually it's a cohort study, right? So there is a follow-up element, and let us say that the 100 people I took today, they were all age more than 40 years, some 40 years, 45 years, 50 years, whatever age, but not less than 40. So common sense, if I take 100 people, I follow them for a period of 10 years. After 10 years, I find out how many people, yes disease or no disease, or some cohort study you are planning. So there will be some people who are 39 years of age today. After 1 year, will they be eligible to enter into study? Technically, yes, because they'll be 40 years of age. And after 2 years, there may be some patients who are 38, they will be eligible. So if you that's what the concurrent and non-concurrent is. Listen carefully now. If you keep your cohort as open, that I will ask people to come in, or people may leave my cohort. So people coming in, people going, this type of cohort is called as open cohort. Open cohort, also called as a concurrent cohort, also called as a dynamic cohort. So the dynamic cohort or open cohort or concurrent cohort will keep on changing over time. So that's the only point you need to know, that in a concurrent cohort, the cohort, what is cohort? We already discussed this. What is cohort? Cohort is a group of individuals with common characteristics. Put it in your gray matter. So what is concurrent cohort? The cohort will change over time. Of course, it is more statistically challenging, but it will give you better results. It gives us better results because it goes with time. With time, people change. So you should change your cohort also. You should not keep that same fixed data with a concurrent cohort. So what is there in a non-concurrent cohort? If I say that this is my 100 people, and I'm going to stick with this 100 people. Over next 10 years, these are the 100 people I'm going to study. Nobody comes in, nobody leaves. Of course, leaving can be there. It's not in your and my hands. But nobody new inclusions will be there. There will be some non-responders, or there could be some attrition. But the new inclusions would not be there. This is called as a fixed cohort. This is called as a fixed cohort or a non-dynamic cohort, also called as a non-concurrent cohort. So what is a fixed cohort or a non-concurrent or a non-dynamic cohort? That is the cohort is going to remain constant. So please note that in a concurrent cohort, the cohort will change over time. It is going to give you better results. So that's all that you need to know about the concurrent, non-concurrent. Coming over to point number 3, what do you mean by a nested case control study? taking a similar example, that let us say I take 100 individuals, and over the 100 individuals, I'm going to follow them up for a period of 10 years or 20 years or whatever years. And then in the last, I'm going to find out how many people are with the disease, yes, disease, they develop the event, yes or no event, whatever it is. So this is classically a type of a cohort study. This is classically a type of a cohort study. That is what you already know, right? This is a type of cohort study. Now I'm going to complicate this cohort study. Let us say I take 100 individuals, same example I'm taking for the concurrent, non-concurrent. 100 individuals, age more than 40 years we take. And today, let us say it is some year A. So it is 2022 today. So obviously 100 people will be there. Some people might get the event of interest. Let us say we are talking of the coronary artery disease. Some people might get heart attack in 23 or 24. Not everybody is going to get in 2032 together, right? So in this whole process, there might be some people who get it in some years. So if you take, mind it, if you take the people who got heart attack or coronary artery disease this year, let us say 2 people got, and you take from the healthy people who are remaining another 2 people. So every year you can actually do a case control study. Every year we can plan for a case control study, Within the same cohort, are you able to get that? So you take a cohort of 100 individuals, every year they will be getting some event of interest. You do a case control within that same cohort. This classical type of study is called as a nested case control, MCQs on nested case control. Nobody is going to ask you to do a nested case control, only direct MCQs. If you want, you can directly cram them up for your exam. But a nested case control, NCC, what is it type? It is a type of which study? It is a type of a cohort study. It is a type of a cohort study. What is a nested case control? You are doing case control studies. Case control studies are done within a cohort group. Within a defined cohort group in a defined time. That is what is a nested case control study. What is the advantage of a nested case control study? It is going to give you the advantage why? Because case control studies will give you what? They'll give you the odds ratio. The cohort studies will give you what? They'll give you the incidence or the attributable risk so you can get better results. You can get better results in a nested case control. Please note, this has been asked a couple of times, lot of times. Nested case control, what is the study of choice? It is a study of choice for what? Please note, it is a study of choice for rare investigations. It is a study of choice for expensive investigations. It is a study of choice for rare or expensive investigations. Nested case control, direct hit point MCQs for you. Coming to the next type of study design, I think study number 4, we need to talk about retrospective cohorts. I told you some time back that cohort studies are what? They are prospective studies. So what on earth is a retrospective cohort? See, let us say that I take an example. Let us say that this is the timeline. Okay, let us assume that this is the timeline. Let us say that I plan for a study that I take 100 people who are getting deep vein thrombosis and I take 100 people who are normal. I ask these females, all are females, like 100 normal females and 100 females with deep vein thrombosis. I ask them, do you have a yes OCP user or a no OCP user? So I ask them, are you a yes OCP or a no OCP user? What type of study design? Common sense, this is a type of a case control study. Okay. Let us say I take 100 individuals to whom I insert IUD. And I take 100 individuals to whom we give OC pills. And let us say I plan to do my study for the next 10 years. So if for the next 10 years, today it is 22, 23, and for next 10 years, by 2032 or by 2033, we are going to do this study. So at the end, we are going to find out how many people, yes, deep vein thrombosis, no deep vein thrombosis. What type of study design is this, beta? This is a simple type of cohort study. This is a simple type of a cohort study, right? So now let us complicate these study designs. What if, let us say that today is 2022 or 2023, and let us say that I go back 10 years in time. So if I go back 10 years, let us say I get the data from a PHC, right? PHC, you get the data who were using IUDs and females who were using OCPs since last 10 years. So you take the data from, let us say, 2010 or 2012 or 13, 14, 15, and then today only you call them up that, Amma, where are you? Do you have yes DVT or no DVT? Please note that the DVT might have developed anytime during that time, 10-year period. But you mind the language. You start your study with what? Do you start your study with the people with the risk factor, no risk factor, or do you start your study with the people with disease or no disease? Please note, you started your study with the people with the risk factor or no risk factor, people with OC pills and no OC pills or IUDs. And then today you happen to make a follow-up. You could not follow up for the 10 years. So technically, this type of study is called as a cohort study. Why? Because you start your study with people with risk factors. So this type is called as a cohort study, but there's not a normal cohort because you went back in time and then you picked up your cohorts. Right? So this type of design is called as a specific design. It's a retrospective cohort. Retrospective cohort. So please mind it, when will the examiner ask you retrospective cohort? I think I'm just giving you a hint. It is not a pure keyword. The hint is that whenever the exam will say that we went back in time and historical maybe cohorts or case risk factors were taken, some medical records were taken. If the MCQ says medical records were taken previous time, think of maybe the answer is retrospective cohort. Are you getting me? I'm not saying it's 100% keyword, but if the MCQ wala says that there were medical records taken up, maybe the answer could be retrospective cohort, right? So sometimes we can plan another type of study. So that is what is one type, retrospective cohort. So beyond the retrospective cohort, there could be another type of study that may be asked to you in your exam. See, if we are taking very time back cohorts or long time back people, so in 2010, 2015, 2005, this long time back, the data quality could not be very good. So there are chances that the data quality is not there or the data is not available. So what do we do is we take reasonably early retrospective cohorts. So let us say I take data from 2017 or 2018. So if you take 2017 data, so from 2017 till today, let us say 6 years have already gone by. So you follow up, you've already done a 6-year gap, and next you follow up for next 4 years or 3 years, and then you find out how many people have disease or no disease. Are you getting it? So basically you are mixing a retrospective and a prospective element. So this type of retrospective and prospective cohorts, these are called as mixed cohorts. These are called as ambispective cohorts. So I have discussed with you two important types of cohorts, beta. So the cohort study that you already know could be of many types. One of the type could be a prospective cohort. If nothing is given in your exam, the answer has to be a prospective cohort because innately, in general, the cohorts are always prospective if nothing specified. But the cohort could also be a retrospective cohort. When do we say a retrospective cohort? When we go back in time and take people with the risk factors or no risk factors. And there could be also be ambispective cohort. What is ambispective cohort? It is a mixed cohort, that is the retro and the pros element cohort. So these were some of the points that you would like to remember about retrospective cohorts and the ambispective cohorts. Next in line, I would like to make a single summary table for you all so that you can put all your information together in a single table, and before the exam, just revise this table. So we are going to discuss cross-section studies, case control studies, cohort studies, and ecological studies all together at a single time. All are types of analytical studies. Please note, ecological is a type of analytical study. Cohort, case control, cross-sections are definitely types of analytical study designs. So first, MCQ number 1. What is the unit of study? In a cross-section study, the unit of study is individual. In case control, it is again individual. In cohort study also, it is individual. In ecological, the answer is population. The study of choice, the unit of study is a population. What are the names of these? The cross-section study is also called as the snapshot of the population. The case control study, these are called as the retrospective studies. Cohort studies, these are called as the prospective studies. I know they could be retrospective, they could be ambispective also, but if nothing is mentioned, please note cohort studies are prospective designs. Ecological study is also called as a correlational study. Ecological study is also called as correlational study. MCQ number 3. How do you conduct a study? How do you conduct? In a cross-section study, we always conduct a survey. Survey is taken, or the total population is generally taken. In a case control study, it is interview based. In a cohort study, it is always a follow-up based. And in ecological study, usually a data resource is taken. A data resource is usually selected, and based on the data, you tend to correlate the events. Question number 3, what is the outcome of a cross-section study? What did you study? Cross-section studies will give you what? The cross-section studies will give you the prevalence. No study gives you prevalence except a cross-section study. In case control study, beta, what are we going to get? We are going to get the odds ratio. You remember odds ratio equal to 1, more than 1 or less than 1. In cohort studies, we are going to find the incidence. We will also find out the relative risk or the risk ratios. We will also find out the attributable risk or the population attributable risk. What is the formula for relative risk? Incidence exposed divided by incidence non-exposed. What is attributable risk? Incidence exposed minus non-exposed divided by exposed. What is population attributable risk? It is incidence total minus incidence non-exposed divided by the total incidence. So please note, these are the formulas for cohort studies. In ecological study, what are you going to obtain? We are only going to obtain the correlation of events, of variables or events. So you are going to correlate the factors. Coming next, in a cross-sectional study, you are going to start your study with what? With the total population. In fact, I would say that this is the important point over here. You start your study with what? You start with what? We start with the total population, or the whole population, or the sample of the population is taken. Whereas in a case control study, you start with population with the people with the disease. You start with people with disease or non-disease. Very important for you to remember. In a cohort study, you start with people with the risk factors or no risk factors. In an ecological study, you don't start with anything. You just start with by correlation of the data. So data matching is done. In a correlational ecological study, the data matching or the data collection and these types of things are done in ecological study. Moving forward, the 5th point could be regarding bias. Please note, there is a special video module on bias and errors in epidemiology, but I'm just summarizing all the biases over here, like most of the importantly asked biases over here. In a cross-section study, the special bias that is there is called as a selection bias. There could also be a classification bias. Classification bias is where you could not classify the disease properly in a cross-section study. In a case control study, you have a special bias that is called as the recall bias. Recall bias is there for a case control study. In a cohort study, you can have a lot of biases. So for example, you can have attrition bias. We can also have a selection bias. We can also have a special bias that is Hawthorne effect. Hawthorne effects, or we can have follow-up biases. So a lot of biases are there in cohort studies, or we can have many more. Ecological study has one classical bias. We already had a word that is called as ecological fallacy. So beta, this point number 5 is important, and all other previous 4 points that you have already done, they are important for your exam. Now with that, we close this topic on ecological study and cross-section study. Let us follow on with the case control and the cohort study. If you talk about the case control and the cohort study, which of the following study is going to give you multiple risk factors can be assessed in case control or a cohort? Please note, multiple risk factors. You have a person with disease, you can check various risk factors. What is this? This is called as a case control study. So please write down point number 6, the multiple risk factors. Multiple risk factors can be assessed in a case control study. Multiple risk factors can be assessed in a case control study, whereas multiple outcomes may be assessed in a cohort study. You also know that MCQ 7, it is a study of choice. Please note that the cross-section studies, they are the study of choice for what? They are the study of choice for finding the prevalence. No study is going to give you prevalence except the cross-section study. But case control study is a study of choice for what? SOC. SOC stands for study of choice. Study of choice. So SOC, I'm just writing it short, right? So SOC for the case control study is what? Study of choice for the case control study is what it is in case of rare diseases or rare risk factors. In case of rare diseases, the study of choice is a case control study. Whereas on the other hand, in case of rare risk factors, the study of choice is a cohort study. Please mind it. I hope you remember, in case of rare or expensive investigations, the study of choice was nested case control. I hope you remember, we already did it when we talked about the NCC nested case control studies. So I hope you understand the things now. Now I think the questions would be very easy for you, that which of the following will be less time taking. Less time taking will be a case control study which is less expensive or cheaper. So less expensive will be a case control study, less time taking will be a case control study, and common sense, more time taking will be a cohort study, and more expensive will be a cohort study. So these are some of the MCQs that you get between the case control studies and the cohort studies, and that was a quick summary table for you all. Thank you so much for watching this module. In the next one, we are going to discuss about the experimental study designs.